Good afternoon. I'll be presenting on optical density and polarized light microscopy to confirm calcification of intraocular lens. No financial disclosures. So intraocular lens calcification actually refers to haziness or clouding within the substance of an IOL. It is rare but a serious complication, and most of us would have encountered this in our lifetime. It can lead to IOL exchange. Both types of IOLs, philic and phobic, they can calcify, and important risk factor is use of gas C3F8 or SF6 for post-keratoplasty or vitrectomy. So if we look at the types of calcification, it is primary when it is related to the intraocular lens, and secondary because of some other factor. So whenever we are in the literature also, the diagnosis has been based on microscopy and very high-end instruments like electron microscopy and X-ray spectroscopy. So in this, we actually studied the calcification in vivo using innovative use of optical density on an ImageJ software on the ultrasound UBM images, and also use of polarized light microscopy, which was available with us. So this case was a 77-year-old male. He presented with a visual acuity of 3/60 in the left eye, 4 years after he had undergone cataract surgery 10 years back. Right eye essentially was normal, but left eye, if you see, his vision was 3/60, and the intraocular lens, more so in the periphery, is opacified. And also earlier attempt to visually rehabilitate him by some other center, his yak capsulotomy was also done. When we did the UBM of this intraocular lens, on the left side is the UBM of the right eye, and at the yellow arrow you can see that even inside the IOL you see that there is hyperechoic shadowing, which is shown in the inset on the above pane. So we had earlier used this ImageJ on differential optical density of fluid on incapsular bag syndrome, which are clinically not very evident. So the optical density is a concept. Actually, it calculates the amount of light received by the sensor while passing through a particular medium. And even in ophthalmology, in other diseases also like retinal fluid and other conditions, this ImageJ software has been used, and it is a Java-based free-to-download software. So this is how the software interface looks like. First, you calibrate the from the sample image, and then you can upload your image. Like in this case, once you upload this image based on UBM or OCT, then you can easily calculate the optical density of whatever area you want to calculate. So in this case, we found there was a significant difference on the optical density, and this is a very, very objective method, more so in subtle cases. So coming back to our patient, the patient underwent anterior vitrectomy and IOL exchange because, as said, there was a PC defect because of yak capsulotomy, and a sulcus placed 3-piece intraocular lens was placed, and his vision improved significantly to 6/18. Now we sent this IOL to our pathologist. She was also really not aware what to do with the sample, which happens with most of multi-specialty practices, where the ocular portion of the pathologist is actually, she also gets foxed. So when she did the microscopic examination, it could reveal these beautiful whitish deposits, which were identified as calcium crystals. And subsequently, on a polarized microscopy, without any specific stain like von Cosa or other specific stains for calcium, these crystals, they resembled actually the calcium carbonate crystals which are seen on urine sediments. So polarized light could beautifully picturize these deposits which were on the surface of the IOL. So this report actually adds on to the existing literature of calcified IOL, wherein you can use a image based on UBM or OCT and apply it to ImageJ software. And even subtle changes in the optical clarity of the IOL can be made out. A word about IOL calcification, that when approaching a case, such case, we should actually make out whether it's primary, which is IOL related, or secondary, which could be patient related. And as an organization, we should ensure strict lens fabrication and packaging, and a national registry may be at AIOS level to report such issues. Thank you.
It's a really good presentation. At last, what is your conclusion?
Sir, the conclusion is that this innovative method can be used in cases where there is subtle changes in the IOL calcification, like the previous surgeon, he would have thought that it is because of the PCO and he yacked it, and such cases sometimes may lead to difficulties while doing a IOL exchange because now we don't have the intact capsules.
Is there any study which has been carried out as to which lens, because there are so many lenses available in the market, the incidence of this calcification is more with which lens?
Ma'am, earlier literature shows that when silicone lenses, they were very popular, so those lenses used to calcify rapidly, but now even where the certifications are not very clear, even other acrylic lenses, they are also being seen, but silicone was the most common.
Very good presentation.
Thank you.